Overcrowding in the emergency room at UC San Diego Health's La Jolla Hospital is forcing patients to be treated in the hallways. Good evening and thanks so much for joining us. I'm Marcella Lee.
And I'm Jesse Pagan in for Carlo Giacchetto. Nurses have been protesting the conditions for months. CBS 8's David Goffredson saw the overcrowding firsthand last week when his mother was hurt and was admitted to the ER.
We want the public to know that the ER is overwhelmingly overcrowded.
My mom was one of the lucky ones. She only had to stay in the UC San Diego Health ER in La Jolla for about 6 hours. She was treated for a broken hand and abrasions after taking a nasty fall in her garden. As I sat next to my mom, I could not believe what I was seeing. Dozens of patients in gurneys and motorized chairs lining the hallway walls being treated in what amounts to a hallway ER.
99% of the time, we don't have really an open room for patients. They're going to be in the hallway, in a chair, for hours and hours.
Maria Tan is an ER nurse at UCSD Health in La Jolla. She says more than 70% of the patients on gurneys in the hallways, similar to these patients in a New York ER, are waiting for rooms to open up so they can be admitted to the hospital.
They have to wait at least 3 to 5 days to wait for a room.
In the hallway?
Yes.
Back in March, nurses at the hospital held a picket outside UC San Diego Health La Jolla to protest hallways being used to treat as many as 75 patients. The nurses also have privacy concerns.
Sick and vulnerable patients are forced to discuss intimate health details with us, with strangers able to overhear.
The hospital has been using a tent for overflow, which can hold about 12 patients. As you can see, my mom was sitting in space Q2 in the hallway ER, with letters and numbers posted every few feet all along the walls. UCSD emailed me a statement saying, in part, UC San Diego Health is currently experiencing unprecedented demand for its medical and surgical care, a need which is outpacing available hospital beds. The impact is most visible in our emergency departments. Temporary use of overflow areas and periodic ambulance diversion are also being used when necessary. One of the most concerning things is this seems to be standard operating procedure. Those nurses were picketing 5 months ago and the hallway ER is still overcrowded. In La Jolla, David Goffredson, CBS 8.